All right. Welcome to my program development plan. My name is Dakota Pullman. I am a student occupational therapist at the University of Toledo, and my site mentor was Lindsay Thomas, an LISW and operations director at Freedom Recovery, and my faculty mentor was Dr. Rachel Miner at the University of Toledo. And my program is entitled The Daily Grind, a Life Renewal Program. So for my capstone site, like I previously mentioned, was Freedom Recovery. They have four different sites across the state of Ohio, one in Columbus, Marysville, Galion, and Dayton, Ohio. They serve individuals experiencing substance use disorder, otherwise known as SUD. And at Freedom Recovery, their goal is to serve PHP in Columbus, Ohio, providing a structured therapeutic setting for people navigating serious mental health challenges with care grounded in faith, compassion, and clinical expertise. Some terms and definitions just to make things easier as we go along with this PowerPoint. Substance use disorder, or SUD, can be defined as someone with a chronic disease where people compulsively seek and utilize drugs despite harmful consequences. Partial hospitalization program, otherwise known as PHP, is an intensive day treatment model for people facing serious mental health symptoms who don't require 24/7 care and is often used as a step down from an inpatient hospitalization or a step up from the traditional outpatient therapy. And lastly, IOP, otherwise known as an intensive outpatient program, is that continuum of care for addiction treatment. It's structured at the outpatient addiction treatment that is a step down from residential treatment or a partial hospitalization program, but a step up from that standard outpatient therapy. So if you think about it in terms of a ladder or stairs, start at detox, then go to partial hospitalization, and then to out IOP. So kind of going in that order. In terms of demographics, there are roughly 48.5 million individuals experiencing substance use disorder within the United States alone. In 2024, adults 18 or older, roughly 33% or 86.6 million, had either any mental illness or a substance use disorder within the past year. And among the 61.5 million adults aged 18 or older in 2024 with any mental illness in the past year, a little over half actually received any mental health treatment within the past year. So, when delving into the literature, I found a couple articles, one by Dagju and Asken from Iceland. They explored occupational therapy's overall role in substance use disorder treatment, just to kind of show the profession's place at the table. During this review, they were able to find that active addiction revolves around the DOC, otherwise known as drug of choice. So, in terms of occupational balance and performance, the drug becomes the main fixture in their lives. And a lot of other occupations, such as sleep, leisure, vocation, all kind of went down the drain as the substance or the drug of choice became more and more prevalent throughout their lives. So these are some key aspects and areas of treatment that an occupational therapist can sort of target. And then Merceline and colleagues in 2025 explored the efficacy of occupational therapy interventions in terms of improving cognitive function and daily living skills for those with substance use disorder. They ended up implementing a trial where they had 12 sessions in total, roughly 45 minutes apiece, working on things such as ADLs, IADLs, and different cognitive assessments. And within those couple of weeks, pre and post implementation of assessments found a positive correlation or improvement in both cognition as well as ADL and IADL functions independently. They were able to rate themselves as being able to participate in ADL and IADL activities better than they were before they had the OT interventions. So, what does this look like in America right now? So there is an act trying to be pushed through Congress. It is called the Occupational Therapy Mental Health Parity Act, otherwise known as HR 4037. It is led by Representative Tim Kennedy, who is actually an occupational therapist himself, as well as Zach Nunn. So, what this bill would do would expand access to occupational therapy services for individuals with mental health under substance use disorder within Medicare, basically ensuring that those with mental health disorders and or that substance use disorder can receive the full scope of OT services by going back to OT's roots within mental health. So basically explaining to medical insurers why we deserve a place at the table as occupational therapists in the mental health groups. So, what I actually did at the site itself, I conducted some semi-structured interviews with Lindsay Thomas. She was the operations director, and as well as counselors, case managers. These range from CDCAs to social workers. And the information that I gathered kind of reflected just general things about the site, the clients, what the current group programming was there anything lacking? And a resounding 100% of the individuals that I interviewed said that there was a need for daily living skills. In addition, I also completed a survey with the initial PHP group during week 3 of my capstone placement, just to get an idea of what different activities of daily living that they enjoy doing, or things that they would like to see a little bit more within the group programming. So I had clients in mind as well. So the goal of my program overall is to develop clients' life skills, routines, and habits that would promote sustained sobriety and to support engagement in meaningful occupations that align with individualized client goals. So the objectives, I have a printout of the objectives handed out and will be connected to this video that y'all will be able to review. But a total of 5 objectives in total that utilize some of the assessments that I implemented during my time at Freedom Recovery in terms of the EMAS, the Kawa River model, and in terms of making sure that clients are actively engaging with the curriculum provided. So, how I created some marketing and recruitment materials overall. On the left-hand side, there are some super cool t-shirts, the Freedom Recovery logo on the front, as well as the logo for the program itself, the Daily Grind. In terms of this, just being able to refer maybe old friends that might need some treatment, being able to advertise to the general public while wearing the t-shirt would be huge, as well as sending flyers to alternative SUD centers. At Freedom Recovery, they do not offer detox treatment, which is that first stage of treatment coming off of the substance of choice. So, sending flyers to these different locales, for example, Arista Recovery is a huge partner with Freedom Recovery in terms of referrals. So, sending some flyers out there saying, hey, we've got some alternative services that you might not have seen before, as occupational therapy being included. So there's a flyer there on the screen just showing where we're at, Freedom Recovery, the Daily Grind, the phone number to call to get started, as well as social media postings. Freedom Recovery does have multiple different social media accounts, whether that's TikTok, Facebook, and Instagram, just accessing a different venue or a different avenue of marketing. So participants, what are we looking at here? In terms of inclusion criteria, looking at people who are actively attending Freedom Recovery's partial hospitalization program. They are then expected to follow group rules and actively participate, as all clients are at Freedom Recovery. The exclusion criteria would be those who are removed in terms of urinalysis, drug screenings, and breathalyzers. If a client were to test positive for any drug or substance use, they would be removed from the premises. And those who are simply just not attending the PHP at Freedom Recovery. So the programming overall, where is all this cool stuff happening at? Sessions are going to occur in the partial hospitalization program rooms at Freedom Recovery. I apologize for not being able to get any photos, but this would look at those rooms. This would look at outdoor spaces with some of the curriculum being based in leisure activities going outside, as well as the kitchenette. So here's a super neat infographic of the 6 sessions that I would be performing or the occupational therapist would be performing at Freedom Recovery. So six sessions in total over 6 weeks. So the OT would host one program a week, 3 hours at a time. That is just how long the group therapy sessions are. So for the first session, introducing the daily grind, introduces the program overall, what an occupational therapist is, and how structure is super important in early recovery and the importance of routines in daily living. The second session is going to look over shopping skills. So, how to shop on a budget. What sort of role-playing activities can we get in with that? Handing out a little sheet that details a person, their income, bills, then dealing with different triggers in public. So, say they're going out shopping and they run into somebody they used to use with. What are you going to do now? The third session, resume building, kind of the importance of a cover letter and a properly formatted resume, kind of role playing, interviewing each other, and exploring transferable skills that are gained during recovery and not shaming those who are in recovery for wanting a job and kind of feeling down on themselves. Session four would be routine building, exploring new healthy habits, routines, finding obstacles, and how to strategize coping strategies and skills, utilizing art-based therapy. Session number five is going to be a cooking class, basically how to stretch the dollar. What are we looking for in terms of ingredients that can be used in multiple different meals and or snacks, creating that for like a sense of accomplishment at the end. And then the last session, session six, would be looking at leisure. So, exploring leisure activities that kind of elicit joy. We're discussing dopamine and exploring games and physical activities during group, kind of getting a little bit more of an understanding of the dopamine effect in everyday life. So, staffing, what would we need for this program? We would need an occupational therapist who is licensed in the state of Ohio. We're looking at a part-time OT, roughly 30 hours per program cycle, 5 hours a week or so. This OT would be responsible for implementing assessments, creating marketing tools for the program, attending staff meetings, hosting groups, and reviewing assessments with the clients. So here's a little snippet at the budget overall. So the OT would be the most costly aspect of this program, looking at roughly $12,000. And then CDCAs, I did 1 to 2 based on client to staff ratio. As many know, in the state of Ohio, there needs to be a certain number of individuals per staff ratio just to make sure that clients are getting the best care that they can based on the state standards. And if you look at the rest in terms of marketing, supplies, the in-kind supports that Freedom Recovery already provides, it is all listed there. For the program evaluation, I decided to use the CPROM. It is a little bit more effective when delving into the research in terms of mental health programming. So an individual would fill this out. It's roughly 30 questions overall, and then would be able to be reviewed pre and post with the occupational therapist. This was used in conjunction with the EMAS long form and the Cower River model that I previously mentioned. In addition, I created a program evaluation sheet, basically a Likert scale from 1 to 5, 1 being I strongly disagree, to 5, I strongly agree. Some of the statements are I am more aware of the importance of daily habits and how it influences my recovery. The individual would then rate from a 1 to 5 how they feel. There are also some open-ended questions at the end, such as what has been the most useful part of the daily grind and what group topics have had the greatest impact on recovery thus far. Clients are then able to add to the program, make any edits that they see fit as they move on. So, what does this imply for occupational therapy overall? As I said before, some literature shows the efficacy and the importance of occupational therapy being included in substance use disorder. So, improving relapse prevention by solidifying independent living skills, the need to go back or to use previous coping strategies, aka active addiction or active utilization of their drug of choice. Instead, teaching coping skills, teaching those daily independent living skills that they can then apply on their own. This then also promotes more involvement in community-based care slash population-based care. So getting OTs out into the community more, developing more of an understanding of what OT is, and kind of gaining a seat back at the table in terms of mental health as this has been a huge push in the past years, especially with the Occupational Therapy Mental Health Parity Act. And I would like to thank my fiance, the class of 2026, and this program overall for teaching me what occupational therapy is about. Here are my references. Thank you.